Acute gastritis is caused by irritation of the protective lining of the stomach, resulting in sudden and severe inflammation, while chronic gastritis involves long-term inflammation. The underlying reason gastritis develops is due to a weakened lining of the digestive tract, especially the mucus-lined barrier that keeps digestive juices and acids from damaging the stomach. A number of diseases and conditions can increase the risk of gastritis, including Crohn's disease and sarcoidosis, a condition characterized by the growth of abnormal collections of inflammatory cells in the body. If left untreated, gastritis can lead to severe blood loss and may increase the risk of developing stomach cancer. Fortunately for most people, gastritis is not a serious condition and improves quickly with treatment. Symptoms of gastritis vary among individuals, while some may experience none whatsoever. In today's video, I'll reveal 5 symptoms of gastritis, its causes, how it's diagnosed, and what foods to avoid if you have this condition, coming up. Hello and welcome to another video. If this is your first time here and you want to achieve an optimal state of health within your mind and body with a little help from Mother Nature, start now by subscribing and clicking the bell so you don't miss any future uploads. 1. Upper abdominal pain or bloating. 2. Acid reflux or heartburn. 3. Feeling nauseous and sometimes vomiting. 4. Loss of appetite. 5. Changes in bowel movements and the appearance of stools to a bloody or black color. Causes of gastritis, how it's diagnosed, and foods to avoid. Detrimental lifestyle choices, along with other factors, can contribute to irritation in the stomach and increase the risk of developing gastritis. It may be caused by the following factors. Bacterial infection. Helicobacter pylori, a bacterium that lives in the mucus lining of the stomach, can cause infections that may lead to ulcers. Although H. pylori accounts for 90% of infection cases worldwide, only some people develop gastritis or other upper gastrointestinal disorders. Doctors believe vulnerability to the bacterium could be inherited or could be caused by lifestyle choices such as smoking and diet. H. pylori can be transmitted through contaminated food and water. Medications. Certain medications such as painkillers or other anti-inflammatory drugs can cause both acute and chronic gastritis. Using these regularly or taking excessive amounts within short periods may damage the protective lining of the stomach. Poor diet. This is also a risk factor for gastritis because it promotes inflammation within the digestive tract, increasing the risk of leaky gut syndrome and food sensitivities. The symptoms people with gastritis experience tend to get worse when they eat lots of packaged, processed, and deep-fried foods. In addition, nutrient deficiencies can aggravate symptoms. Chronic stress and anxiety. Despite not causing inflammation of the stomach like other causes, stress-induced gastritis can trigger similar symptoms such as heartburn and a feeling of a full stomach. Severe stress in patients who are critically ill or due to a major surgery or injury can also lead to acute gastritis, as it may cause erosions and superficial hemorrhages. Detrimental habits. Excessive and frequent alcohol consumption and smoking, as well as chronic vomiting, can irritate and erode your stomach lining, making it more vulnerable to digestive juices and acidic pH levels in the stomach. Other health conditions. As mentioned earlier, gastritis may be triggered by other conditions such as Crohn's disease, HIV, and parasitic infections, among others. Autoimmune gastritis, which occurs when your body attacks the cells in the stomach lining, is more common in people with other autoimmune disorders, including Hashimoto's disease and type 1 diabetes. It is also associated with vitamin B12 deficiency. Older age. Older adults have an increased risk of gastritis because the stomach lining naturally thins with age. Also, because they are more likely to have H. pylori infections and autoimmune disorders than younger people. Studies indicate that adults over the age of 60 tend to experience a gradual erosion of the stomach lining, higher rates of infections and nutrient deficiencies, all of which can make gastritis symptoms worse. Making changes to their diet, such as lowering alcohol intake, consuming fresh produce, as well as exercising and quitting smoking, can help lower the risk of developing the condition. A diagnosis of gastritis is made when tests reveal that someone has marked inflammation of the stomach or persistent symptoms. Your doctor will perform a physical exam, ask about your symptoms and your family history. They may recommend a stool test to check for the presence of blood, a possible sign of gastritis. They can also screen for H. pylori infection and pernicious anemia with a breath test or blood tests. Some patients may get an X-ray of the digestive tract after swallowing a barium solution, which will help doctors distinguish areas of concern. In order to have a look at what's going on inside you, your doctor may perform an endoscopy to check for inflammation. This involves the use of a long tube that has a tiny camera at the end. During the procedure, your doctor will carefully insert the tube through your mouth and down into your stomach. Your doctor will check for inflammation, and if there is anything unusual, they may perform a biopsy, where a tiny sample of tissue is removed and sent to a laboratory for analysis. Foods that may irritate the stomach, therefore making gastritis worse, include alcohol, coffee, fruit juices, deep-fried foods, carbonated and sugary drinks, dairy, and acidic foods such as tomatoes and citrus fruits. Consume very little processed and packaged foods that are high in synthetic ingredients and chemicals, and replace them with fresh fruits and vegetables, ideally organic if possible. Experiment to see if eating spicy foods such as peppers, seasonings and hot sauces makes your symptoms worse. Track your symptoms to better understand how common gastritis foods affect your digestion. For some people, food allergies can trigger gastritis. In these cases, identifying and avoiding these foods may prevent and treat it. The same applies if you notice that certain food groups make your symptoms worse. This is particularly true with food allergies. You might also benefit from dividing meals up into smaller amounts and having them more frequently, instead of eating 1 or 2 big meals per day. The key is to avoid stomach overload. Finishing the last meal at least 3 hours before going to bed will also allow enough time for your stomach to digest your food, ensuring a restful sleep. Are you a health nut? Join the Health Nut Hour today, subscribe to my channel and click on the bell notification, and I'll keep you updated on future videos. See you in the next one.